Good morning, everyone. Thank you so much for joining me here today. I will be presenting my culminating report, which was a qualitative systematic review protocol on the experiences of barriers and enablers accessing pregnancy-related reproductive health services among transgender and non-cisgender people in Canada. This project has had many different versions of itself, and originally was going to be a thesis project and eventually has become this final culminating report. But before I begin, I would like to acknowledge that I conceptualized and wrote this project on the unceded territories of the Kanien'kehá:ka Nation in Tiohtià:ke, which is colonially known as Montreal. So the roots of this project is based on the idea that people of all genders deserve barrier-free access to reproductive health services. But if you close your eyes and picture who is accessing reproductive health care, often we're not thinking of people like me who, I have a beard, I have a flat chest, and because of this, trans and non-cisgender people who lactate, give birth, have an abortion, are outside our gendered expectations of what pregnancy looks like. This can result in standard reproductive health care guidelines, rarely including our experiences, and many practitioners are unsure on how to involve us in care. To change this review aims to identify barriers and enablers to improve access. So why is this significant to public health? Inaccessible reproductive health services has consequences both for health and as well as in terms of our human rights. The Ethics Committee of the American Society for Reproductive Medicine has affirmed that denying transgender people access to fertility care services is a violation of human rights. There also has been research showing that among this population, non-affirming services can result in delaying and avoiding care. And there has been research among trans and non-binary folks who would no longer like to be pregnant that when services are non-affirming, they may attempt at-home abortions in unsafe environments. Among cisgender women, research shows that accessible services reduces pregnancy-related mortality and child death. So this proposed review follows comprehensive JBI guidelines, which is an internationally recognized research organization, and it aims to answer two main questions. The first being, what are the experiences of barriers for transgender and non-cisgender individuals when accessing pregnancy-related reproductive health services in Canada? And the second, what enablers of pregnancy-related reproductive health services promote access and quality care for trans and non-cisgender individuals in the Canadian context? So specifying who exactly we are talking about, the definition that I use is any person whose gender or lack thereof wholly or partly differs from their assigned sex at birth. And apologies for the second part of the slide, this was from a previous iteration of this project. And to put this in visual representation, I like to use a gender umbrella, where we have transgender as the main umbrella concept, and binary folks and non-binary folks, where identities might include demigirl, agender, bigender, etc. And for my project, I explicitly use the term non-cisgender because not every single non-binary person will feel included in the transgender umbrella. And so just to use language that is as inclusive as possible of the very diverse community, that's how I defined that population. And in terms of the main phenomena of interest, as I've alluded to in the research question, it's the experiences of barriers and enablers when accessing pregnancy-related reproductive health services in Canada. And I cite the three-prong approach to reproductive health in order to specify what exactly we're talking about when it comes to pregnancy-related services. So these include contraception, preconception, abortion, lactation, pregnancy planning, and fertility. In terms of other important criteria, inclusion criteria of this review, I specifically focused on qualitative research, and it would also include qualitative components of mixed methods research to focus on lived experience. And there was no limits to what context reproductive healthcare in terms of setting, as long as it was in Canada and services were provided by a healthcare professional, and there was no limit set on date. Then the proposed review would include English-only studies just to avoid any meaning being lost in translation. So in terms of strengths and limitations of this proposed review, prior work on this topic is done in the international context, so it puts various different healthcare jurisdictions into one. So this review would be the first time that it's tailored to the Canadian context. Using JBI standards means that the project would have a strong methodological rigor and we could be confident in the results. And using qualitative research means that the findings would be grounded in the lived experience of community members. But unfortunately, this means that we are limited to the literature that is currently published, and this might exclude critical intersections of identity. So for instance, an Indigenous trans person is likely going to experience different barriers than somebody who's not Indigenous, and based on the literature, their experiences might not be represented. And the final limitation that I wanted to mention is that is one that the methodological, it's a limit of most systematic reviews just based on how they are structured, because they center a Western I'm so sorry, this word, epistemological viewpoint, because of how we hierarchize peer-reviewed research, which excludes Indigenous knowledges and oral histories. So in conclusion, this proposed review, despite its limitations, would provide an opportunity to integrate the latest research into guidelines, policy, and practice. And it would help identify actionable recommendations to policymakers, healthcare providers, to enhance the quality and accessibility of pregnancy-related reproductive health services across Canada. And before we move on to questions, I just wanted to thank everyone who has contributed to this project, including my practicum supervisor, Emily Clark, at the National Collaborating Center for Methods and Tools, as well as the rest of the team, the faculty of PHSP, and the Social Science and Humanities Research Council for their generous funding. So thank you, everyone.